So now we're going to shift and we're going to open up the panel discussion. So we're going to bring up all of our morning speakers. We're also going to be adding a few people that can offer their expertise. So we're going to be joined by Michelle Hurt, Patty Serio, and Veronica Foley, and I'm going to give each of them a chance to just briefly introduce themselves and the programs that they're representing. So Michelle, can you start us off?
Sure. Good morning, everyone. My name is Michelle Hurd. I am the director of the New York State Clean, Green, and Healthy Schools program, which is a statewide school environmental health program housed at the New York State Department of Health. And one of our main focus areas is IPM, along with indoor air quality and several other areas of environmental health. And we work closely with a large number of partner organizations in New York State, including Cornell IPM and all of the other panelists and presenters from today's conference, to name just a few. So I'm happy to be here. Thanks.
Welcome. Patty, can you introduce yourself?
Muted.
Thought I unmuted myself. So I'll start that again. Hi, my name is Patty Serio. I am at Oneida Herkimer Madison BOCES, otherwise known as OHM BOCES. We do a lot of services with our component school districts, and that ranges from everything that you can imagine besides the instruction of students, but we're kind of getting into that a little bit more as time goes on, especially with the challenges we're impacted with today. So really, we kind of, do our best to really help school districts with their IPM policies, IPM practices, and steer them in the right direction as to what they need to do, where they need to go, and how to get the right answers.
Great, thank you, Patty. And Veronica, we'll have you introduce yourself.
Hi, my name is Veronica Foley. I am the Assistant in Health and Safety and Healthcare for the New York State United Teachers. My role is to support our membership in every way possible when it comes to issues that may affect their health and or safety in school settings. So I'm happy to be here. Thank you for having me.
We're thrilled that you're here. And when we had planned on doing this as an in-person conference, the United Teachers Union was great. We were going to have the conference there, and Veronica was really, really helpful in getting that set up until we couldn't do that anymore. So thank you for all of your previous work, and thank you for being here today.
You're welcome.
So, Deb, you've been monitoring the chat. Do we have any questions to get started with?
Not really. The one big question that came up was the grubs question. And other than that, I did find that it was, we have had this question in the IPM program over the last few months. Curious how school building people were working, if they were working, limited time or they're keeping busy, because we all know there's a lot to do when students are not in the building. So it's been good conversation with people, and we appreciate everyone paying attention to the morning. We know it's difficult to sit in front of a monitor. So we'll go back to the panel discussion. Thanks, Joellen.
Okay. So I had a question where I wanted to kind of tie in Lorraine's talk with a question for Daryl. Lorraine, you had mentioned the building assessment that was done, but that wasn't done specifically by you. And State Ed also does an occasional building assessment. Do you know if those were the same or if it was a different assessment? And
yeah, I can answer that question. The assessment I talked about was done in the New York City Public Schools. They have a process where they invite architects and engineers every 5 years to go through all of their schools, and you can find on their website the school building reports for all of their schools. I think it's very similar to the one the state does, because I think there is some, because I looked into this, There is a statewide assessment of all public school buildings. I don't know if it's identical to New York City's, but it's very similar.
Okay.
And I don't know how frequently it's done.
And that's where that question then leads over to Daryl. I think that's due to be done soon. Is that correct, Daryl?
So that was just changed by statute. So the legislature just put a change into law, and we are trying to follow the process that New York City uses, in that what we had been doing was building condition surveys as well as annual visual inspections, and they were kind of, duplicative, and so we are moving currently to a process where we're going to be doing building condition surveys every 5 years, but that's because there are so many districts across the whole state, and we didn't want to crush everyone with okay, let's start the 5 years right now and everybody has to go do. So we're trying to spread them across 5 years so that a fifth of the districts will be due every year, and it will roll every 5 years. You'll have another requirement to do a building condition survey, and we are just in the process of changing to that new way. So it's confusing, but so this year there are a number of districts who were identified as really needing to not go for another 5 years without getting somebody to look at their existing buildings. So they're on the first rollout, and at the same time, we're still holding on to those visual inspections for the districts that don't have to do the BCS, the building condition survey. And then, as I said, it's gonna hopefully smooth out, and it will be a fifth each year. We'll have that requirement. And that's an online reporting of every instructional building. It's a survey that, Lorraine, you might have become familiar with. And again, we're trying to, I think New York City is excellent in that they do make it all very open and transparent. You can see everything. And we're not as good at that. We're trying, I think we want to get there, but so we're following in those footsteps.
That's good. That's good to know, Daryl, because I actually did try to access that at the state level and found that I couldn't, because one of the things, sometimes criticism of research in cities doesn't necessarily apply to rural school districts and small town school districts. And I wanted to be able to replicate what I'd done in New York City to look at how school climate, academic expectations might be reflected in the condition of the school building, to see if that was true across the state. But I did have accessing the building condition information. But I'm glad to see that the state is moving forward with that. Yeah.
And I'd be happy to share with you what the survey is. I can share you a copy of the survey if you have specific districts that you want to see what their previous reporting was. I can find that information.
Okay. Thank you.
So
and just a comment on that. Originally, that law was enacted in 1997 and took effect in January of 1999. They were all to be uniform so that you could compare city and upstate and the island and so forth. But the city council, I think, exempted itself and put it in its own format. So you should have. They are somewhat comparable, but they're not identical. And I do know Michelle's office, in terms of the drinking water, in terms of some of their research, has done sort of a comparison looking at New York City and upstate.
And I would also tell you, Joellen mentioned my work as the legislative chair. That was our bill that got the process changed. And originally it was every school district would do it in the same year, every 5 years. And two things happened. One is we overwhelmed the state education department because they didn't get additional staff to handle this. They have the same funding issues we have in facilities in school districts. Here's a new process for you. You're going to do these 5-year building surveys for every school district. And how much more staff are you getting? Oh, none. Plus, an interesting thing about facilities planning, they're the only agency in the state education department that's fully funded by the state. They don't have federal grants that are servicing most of their programs. So one of the things we lobbied for over the last several years was to get them a new computer system, because their computer system was running on DOS. And like, for instance, to share the information from facilities planning to state aid, somebody would download information to a floppy disk, some of you may remember them, and walk it across the building and load it in another computer. So one of the things we found though was the whole idea when the legislature wrote the law, and we've all in our different backgrounds experienced the legislature come up with a solution for a problem they don't know a lot about. They said we're going to do this all at the same time so we get a snapshot in time of the needs of the school facilities. And they could do multi-year planning. Okay, now multi-year planning and the legislature, let's just let that sink in for a moment. Okay, and then we realized that wasn't happening, and we were still doing the annual visual inspection, which was another state legislative regulation, which meant you walked around and visually inspected your buildings. Now, just some background on that. That came about because of a disaster in Westchester where a wall collapsed, and what caused the collapse of the wall was some structure inside the brick that you would never see doing a visual inspection. But that was some legislator's solution to that problem at the time, and it really wasn't effective from use of anybody's time, and it wasn't being used when it got to state ed. And that's how we went to this rotation, because the other unintended consequences of everybody doing their building condition survey at the same time is then everybody came out with the correction projects at the same time. So we flooded facilities planning, who still hadn't gotten more staff. It took longer to get the projects approved, which increased the cost. And then everybody's projects started hitting the street at the same time. So now you flooded the school construction market and prices went up. So that's why the bill was changed, and it's not to lessen anything. It's still the same rigorous, exam and that we did, but we do it on a basis. So, and when it rotates, it doesn't rotate by region. It's 1/5 of each region of the state gets done at a time. So we're not overwhelming the professionals to do the survey, and we're not overwhelming the rest of the marketplace. And just while I'm talking, just because the product we used, I went while we were looking, it was Promax. And that was back in 2012. So, to give some perspective as to choice in the time. That was the product we used for grubs.
And just to further the point on the building conditions survey, with the breakup of the different school districts over the course of 5 years, really does help provide a quality report, because some of these reports were done so quickly. Some of them are done by drive-by. They really weren't looking at the school districts the way they should have been. So having this shift really does impact the way that these reports are done and the quality of these reports.
I'll just add something about the BCS as well. We are at the health department, the Clean, Green, and Healthy Schools team, which is very small and has competing interests, but we are trying to look at those building conditions over time for upstate, and also look at some of the components of that in relation to test scores in an aggregate form that's publicly available. But that's very difficult because the SED data sets are not, as was previously mentioned, aren't in the greatest shape and aren't the most usable in the way that they are. So it takes a lot of work to get them to something that you can use. The other thing that I wanted to say about New York City and upstate is that they are different and they are not compatible in terms of trying to use them to do any kind of analysis statewide. We did look into that very extensively, and we determined that it just wasn't feasible to do because they were too divergent. So I just wanted to add that.
I guess I'd like to add that the importance, I'm glad the State Education Department is doing these things, because I've looked at school building condition, not just in New York State, but across the country. And one of the problems with tying school building condition to student outcomes is not having a consistent way of measuring school building condition. That different districts may do it differently, but also different states. And if we want to make an impact with our legislators, and remember, they cycle in and out every 2 to 4 years. I mean, some stay longer, but they're on these cycles where they'd like to see results when they come up for re-election. And we all know that educational outcomes take years to show. You know, did we produce healthy adults? Well, that takes 18 years. And so in order to show that what we did in the school buildings and with the teachers to people who make our laws, sometimes we're put under pressure of showing results right away, so that they can fund us and then get reelected. But it's really important to have consistent way of measuring school building conditions so that we can compare and so that we can show how building condition is related to student outcomes and teacher outcomes as well.
So these statewide school building assessments, big S, done to various degrees. I just want to make a pitch that the Green, Clean, and Healthy Schools program, as part of that, there is a site assessment component that is developed to be done by people that are on site, the maintenance facility, parents, teachers, to really look at what's going on there. So I don't know if you want to address that, Michelle, at all? Because that should be a consistent measurement for everyone that is involved in that voluntary program.
Yeah, a main component of the CGHSP, which is easier to say, a main component of many of the 9 focus areas that are in that program is a walkthrough and a checklist. And the checklists are EPA checklists, so they've been around for a while, commonly used through their Tools for Schools program, but we've adapted them for New York State. And so if schools are doing that, then that's kind of a consistent way. The other thing that we do include in our program that I think is really important and as a starting place is a self-assessment form. It just is a way to cover each of the areas, IPM and IAQ and all of that, in a way that, to assess where a school stands on all of these issues at the beginning of the program and at this point, whatever point in time that is. And then from there, develop goals and objectives. So some of the things that Fred was talking about where he discovered, when he took over the job of the way things were being done, they can be analyzed and noted in one place and then develop goals and objectives to improve all of those over time, however long that might take. So I think that's another important aspect to all of this.
I have a question. Oh, I'm sorry. Go ahead, Veronica.
Okay. Yeah, I would just like to add, I've been listening to everybody and specifically what Michelle just said about walkthroughs and kind of this concerted effort within a school to consistently assess what's going on and to also make plans for changes. This is important to have, of course, the involvement of employees as well as students and administrators. And one thing I must say I liked about the annual visual inspection is that it's clear in the SED regulations that inspection in particular needs to include somebody from the Health and Safety Committee, which is also a requirement under SED. From personal experience with NYSET memberships and districts, there often is not a health and safety committee. And this really would be the consistent group that carries out the work that Michelle's program sets forth with the 9 objectives and the checklists and kind of educating people as they go in order to speak to a lot of these concerns. So I would say that it's very important to have some type of organized group in the school that is doing this work and that it's transparent with the teachers in the classroom who are experiencing this in real time with these students who are affected by poor conditions. And also the building condition survey, my understanding is that is to be done by a licensed engineer or architect. There's not language that requires that is done with participation of really anybody other than them in the school. And one thing that we've been doing, especially since COVID has started, is I'm working to empower our local leaders throughout the state to request copies of this. And also I've shared the SED webpage where some of this can be found so that they can kind of understand what maintenance projects have been suggested over the past 10 years that haven't been acted on, to kind of set a base for a conversation about what state their school is in. I mean, these school reopening plans currently are talking about almost every safety and health program we know of all at once. In a time when schools are struggling for funding. I know Fred brought up the concerns about staffing. I mean, purchasing the resources to do cleaning and disinfection in a safe way. I'll also just throw in, you know, I have major concerns specifically because I've been getting a lot of questions from the membership about HAZCOM training. Teachers are being handed disinfection products that they're actually asked to spray. Some of them seem to be foggers, and there's no talk of personal protective equipment. People are freaking out. They're sending me the SDS sheets. You know, it's there. I just want to reiterate, I think, kind of what I'm deducing from all of this and what I'm focusing on in my work is we really need to get these health and safety committees together so that there's a joint effort and that there's transparency about what's going on. You know, you can all kind of hold each other mutually accountable for getting the work done and understanding what the reality is within the school. And once we can shine a light on that, I think, you know, we can work towards, you know, different legislative efforts or organizing efforts that will support the community as a whole.
That's a great segue, because I think one of the questions I asked when I was doing the presentation is, for the purpose of reopening buildings that have been closed down for a while, you're obviously going to have to do some sort of walkthrough and look around and do some assessments on what needs to get fixed up or cleaned up, or maybe there were storm damages during the spring. So we hope, and that everybody's kept a list of those minor maintenance and repair things that you don't have time to get to right now, because it's going to be a bumpy ride and they're going to be school closures. It's just going to happen. No matter how hard everybody tries. And so that's a great time for New York State to help everybody invest in doing those minor maintenance and repairs when the buildings are closed. It's really important. I also think it's important to be careful about using something like a fogger. There's not a lot of evidence on these. In fact, if the building's been closed and you have somebody come in and spray it, if the building's been closed more than 5 or 6 days, there's no virus that's left that's effective anymore. So don't waste money. That doesn't make any sense. But in terms of classroom work, that's a bad thing to do around children. The only products that ought to be used for fogging are those which have explicit directions on the label that said they can be a disinfectant that's used as a fogger. You can't do it with just anything. It has to be on the label. And EPA is very clear about that. So the misuse of pesticides in schools is a serious issue. And childcare as well. You can do a lot of damage with a little bit of chemical that you don't need to do, and you may not need to spend the money to do it.
I'm envisioning part of the plans that I'm reading are they're going to have not only breakfast in the classroom, but lunch in the classroom. And they're going to start the kids are going to have to be doing cleaning up, and what products are they going to have access to, and making sure that everyone is aware of the label requirements and not allowing.
Well, children cannot use disinfecting wipes.
Right, absolutely.
It's on the label, not for use by children. If it's on the label, not for use by children, children can't use it, period.
It's also in the SED guidance. The recent guidance makes it very clear that children aren't to disinfect.
Right.
I think one of the things when it comes to things like foggers, and the other big thing is electrostatic sprayers. I've seen discussions of, you know, products that'll leave a coating for weeks at a time. Are there label instructions? Is it necessary? But I think the overwhelming problem is how good the salesman is and who he's pitched it to. because many school districts just say, see, we're doing the best thing we can possibly do. It's not the case here, but in others where, no, we've got to do this because we got to show the community we're doing everything we can.
Yeah, the embedded products and the surfaces like a microban don't work. That's something that we documented with the Healthy Building Network. It's in our report that's up online. It's in the appendix on cleaning and disinfecting, along with some comments from Green Seal on foggers and electrolyzed water. Some of those things work depending on how carefully they're used. And that's one of the troubles, I think, with electrolyzed water is it deteriorates and loses its efficacy in a hurry.
So if we can kind of shift back to pest management, so we can stick to COVID for a while. So Claire, you had asked what people can do during closure times and certainly doing assessments and look to see where there are openings into the buildings and try to address that. Jody Gangloff-Kaufman in the chat box linked to a resource that we have for the Scientific Coalition for Pest Exclusion, or SCOPE for those in the know. And we've been working on a particular assessment just for schools that can help to assess for rodent openings especially. But also some of those recommendations are, leave doors and windows open for ventilation, and here come the yellow jackets and the rodents in there. So these are all things that we haven't quite figured out yet, but we're going to be seeing that, and we're going to be working on that as well. So for people that are not on the panel or wasn't a speaker, and you can go on ahead and unmute yourself if you've had any experiences with these kind of issues that you'd like to share.
Or maybe if they've got a short list, or they're doing door sweeps or caulking or screening, or, I mean, everybody's got a short list of things that have to get done. Be really interested to hear people speak up about those short lists.
I'll break the silence for a moment. There was a question I saw pop up in the box too. Is there a coordination between the pesticide management people and the facilities people, the cleaning staff? And yes, because it overlaps. So Claire's talking about, door sweeps and things like that. I spoke about in mine, routes of entry. When we start to see pests appear, it's, well, how did they get here? And how did they get in the building? So we're looking to see how did they get in, then what attracted them. So what can we delete from the environment that attracted them, but what door can we close? Whether it was a crack in the foundation, whether it was, underneath the door, those are things that as they always should be part of the discussion when you're doing your treatment. And those are things that, much to Claire's point, sometimes you knew about, but there were some kid thrown up in the hole, so that didn't get done that day, and so I'm just saying that school closure time is a great opportunity, Claire, to start, as you said, to look at some of the things. What are the things we didn't get to that we can do now?
Another question that was asked in the chat box is how many people don't have a pesticide applicator on staff and are contracting out their pesticide services. So if you go down to the bottom of the screen, towards the right-hand side, you'll see reactions. So if you are contracting out pesticide services, if you could just give us a thumbs up so we can get an indication of what's going on out there. And so it doesn't look like anybody.
There was one hand.
There was one hand, okay.
I think the way the pesticide license costs have gone up made it very likely that schools did not have licensed applicators on staff. Plus they have to maintain I think a $1 million policy for, an insurance policy. So it just became unrealistic for schools to keep pesticide applicators on staff.
And I asked the question because basically what I wanted to remind people of, if they are contracting these services out, is to make sure that those notifications, all the necessary things, the record keeping, any SDS sheets, all that stuff is being stored and maintained for that certain amount of time that it has to be maintained for. There are some companies that are good with it, and there are some companies that are not so good with those types of records. So just as a warning to folks that do contract out, making sure that you have those, I guess, checks in place when hiring a company.
I have a hybrid. My grounds, I have applicators on my ground staff, and those will age out for just the reasons Jody's talking about it. But structural is done by a contractor, and our bid spec is written in such a way that before they can apply, they come to the building. There's a logbook that the head custodian maintains that tells them, okay, Mrs. Smith in room 202 said she saw a bug. So what they're going to do first is put down sticky boards or whatever to see what is the bug, and then they're going to propose, a treatment. And before they can apply a pesticide, they need my permission to do it. So we have to have looked at it, we have to discuss it, and they have we have a catalog with them of products they may use and have the SDS sheets and everything. So as we're discussing that, I've got that information handy to look at. But it's just not just, oh, we came in, saw this, we did this. Things like sticky boards, mouse traps, things like that obviously don't require that heavy discussion, but it is a process, it is a discussion. Because again, we're looking at, did we have ants because they're a problem, or do we have ants because there's food all over the place? So that's how it, I think if you're using a contract, you got to make them an extension of your employees.
I was in a private school that was contracting out their food services. And I found huge issues in the kitchen itself with it not being cleaned. And it turned out that the contractor thought that the school was responsible for cleaning, and the cleaning staff thought that the contractor was responsible for cleaning the kitchen. And so it just never got done. So no matter what contractor you're working with, you have to make sure that all those details are nailed down and followed. And speaking of contracting, Claire Barnett asked how many schools are contracting out cleaning, with the sad story of a cleaning company that was recommending that kids use disinfecting wipes.
Yeah, this is Michelle. I just wanted to add that, in these contracts, spelling out exactly who's doing what, but you also have to make sure that they are aware of all of the regulations that apply to schools, in terms of pesticides or disinfectants, things like that, because these companies don't always know. So you have to be on top of that.
And I would also say that this is not something you want to write a spec that you're not getting, that highlights qualifications and expertise and experience over price, because you don't want the cheapest guy necessarily. You want the safest person.
Mm-hmm. All right, I'm not seeing any other questions in here.
I'd like to make a point or just reiterate something that Fred said, if that's okay.
Absolutely.
Now, Fred, you're one of the few people, one of the few school facility superintendents that really talks about using a logbook. And that's an old school way to foster communication between the pest control company and the facility staff, and a central place for all that information. And I just want to make a plug for it because it works. And if you're in a school and you're not using a logbook, we can help you put one together. It's pretty simple, but the things that you might want in there would be in a central location. They'd be handy, your MSDS, your labels, and record keeping. And even the policy for the school, so you can refer to it. So let us know if you want that help.
And actually, if you want our help on other issues as well, we've all gone into schools to look at rodent issues or cockroach issues. We've gotten on the phone with people about bed bugs. So we are a resource, and we're here to help.
I will add from the perspective of possibly custodial staff that may use these products. I'm just going to reiterate the HAZCOM standard, which does require the SDS sheets to be on site, as well as just a written program in general that explains how training is given. And part of that training has to include how to identify symptoms of overexposure to different products that are used. Not only is that important for the staff, but having an idea of what that is can also help identify if anybody else in the school community has been overexposed to something that is being used, which I think is important information for more people to have than just the staff using these disinfectants or pesticides.
So Veronica, you had mentioned earlier, health and safety committees are required by law, but you often see that they just don't exist in schools, and I've certainly seen the same thing. So I guess the question for the group as a whole is, how do we work to make sure that schools do have active committees that are looking at these issues? So getting the community involved to address some of these building condition problems or process problems that we can then use to protect children and staff.
Well, if I can start, from the labor perspective, one of my goals as the health and safety person for NYSUT is to advocate for and empower our membership to be active, to take up this issue and to speak to their school administrations about what they have a right to, which is to have a seat at this table, and to pressure the school to do what they have to, which is to make sure that this committee exists, that the right people are on it, which includes labor activists, teachers and labor activists, parent organizations, and school administrators. So, I'm working from that end of labor activism to get people to start asking questions. But I must say, Michelle's program is incredible in terms of guiding people on how to talk about different issues. In my experience working with committees, specifically in New York City, with different city agencies, is if people were not educated on how to speak about different health and safety concerns, the committee quite quickly can turn into a work order checklist, what has or has not been done. So I do think it's really, it's imperative that there's also education to teach people how to carry a conversation about pesticides, what questions to ask, what to do with the answers that they're given, to understand the laws and regulations. And this can cover any topic. So there's a huge, there should be an emphasis again on this. And the EPA checklist that Michelle brought up, I think are really, really useful, because these are dense and technical subjects quickly. And as long as people, can get it started, but then can maintain a conversation, I think that's key. But that does take engagement from all parties.
Right. Veronica, one of the things that we published quite some time ago, we have this online. This is a free guide that was written years ago with including NYSUT and Department of Health and DEC. And it talks about how to establish a committee, what the law is, how the committees work, how to do a walkthrough. The purpose here was not to tell facility directors how to do it because they do know how. The idea here was to use this as an educational piece to pull in other people to help them think about thinking more broadly, thinking about making this a comprehensive plan and not just a single issue, as you're saying, a work order list, but an ongoing process of school improvement. And that's really interesting because the science on how buildings affect teaching and learning, the science there has grown exponentially in the last 20 years. It's incredible. I mean, the peer-reviewed literature is very, very substantial. I know the state ed department and EPA used to talk about how the facility supports education. It really can dominate the impact on education. It really can. And it's very, very significant. It actually promotes health and thinking and learning, not just supporting it. It's a change in language because the science is so strong.
I'd like to second that, Claire. Yes, that's the field that I'm in, and the research is just, I would say it's undeniable. It's the building is an equal partner.
Yes.
The teacher, it's not just the backdrop. It's not just the stage setting. It's critical.
And it's hard to get,
like to
it's hard to get that message through. It really is. But I suggested when I was doing the presentation, you get it's a free download from the Harvard School of Public Health. Is a publication called Schools for Health. It's an easy read. It's not long. It's free, but you do have to register to download it. I really recommend it to everybody. It's a great recap.
As I was listening to Lorraine and Claire, I recalled a good friend who is a school architect doing a presentation to the Board of Regents, and he started with, I refer to the school portion of my practice as forensic architecture. We don't get called in till the patient's dead. And that's, that happens a lot in schools. I can remember Commissioner Mills, I remember talking about, going to a building, I won't say where it was, where there was scaffold holding up the outside of the building, but meanwhile inside, the facility staff was doing everything they could to keep the building going. And that's part of the problem is getting people to recognize priorities and getting people to recognize things before they become a disaster. And picking up on Veronica's comments, one of the most successful things process I was ever involved in was we were doing a big bond issue in my former district, and we had schools that were overcrowded. We had, art was on a cart, music was in the cart. There was no dedicated space. The libraries were terrible. And as we were, science labs were inadequate. And as we were planning all this, I would meet, and again, my background coming out of the private sector was I worked for a design build firm. We would meet, and I remember this one process with the art teachers, the elementary art teachers. And I said to the director of art, I want somebody who's been teaching a long time, somebody who's brand new, and a couple of teachers in the middle. We had these 5 elementary art teachers, and we sat down. And the senior member of that group said to me, wait, I want to start off. She goes, I understand the classrooms are going in this part of the building. So let's put the kiln in the bathroom. And I go, no, we can't do that. And she said, why not? I don't need a bathroom. And I said to her, well, we're going to gut the space and start over again. And she goes, we can do that. And for so many years, that was their experience. Here's the space, make do with it. And so I got them comfortable then to step back and say, I don't want you to tell me what your room should look like. I want you to tell me what you need to be able to do in the room.
Yes.
Then we would have conversations, and we'd come back and say, here's how. So like even when we were talking about, okay, you're an elementary art class. What's the right number of kids in a group? Is it 4 kids to a table? Is it 6 kids to a table?
Yes.
Okay, so they said it's 4 kids. What's the biggest size project you can see them working on? And they all agreed on, I think, and I'm going back, what that was. So I said, okay, so you're going to need a table big enough for 4 people to work on a project this size. That's how you get to it. And I'll tell you one of the great things I still remember about that. One of the things they told me in the process was we spend an inordinate amount of time cleaning kids up to send them back to class. So we designed in the classroom 2 peninsulas that had large sinks with a faucet on each end, and 8 kids could wash their hands at once. Well, that just cut the time down to nothing. And they were like, that was the best thing we did. I said, but that came out of the conversation you know, because, and I'm not knocking teachers, they're not supposed to know this. I mean, but their experience of what a classroom should look like is the 4 or 5 they worked in their career, you know, but if you start that dialogue and start that conversation, you know, and we came back, here's what we got, and we tweaked it, you know, and we got to a point where we came up with things that really worked for everybody.
I want to add
I'm
too
gonna,
that just to
just
follow up
stop there for a
what Ed
moment.
said. I'm sorry.
Just really
Can
quickly, because I know some people have to leave. So please fill out the post-test survey, which I just put in the chat box. So please do that. I'm going to put it down again so it's right there on the bottom. And for pesticide applicators, make sure that you connect with Gemma before you take off. But otherwise, we can continue on with this conversation as long as people want to hang out.
Okay.
So I'm not sure who I interrupted.
It's Michelle. I've been trying to get in since Veronica was talking, but here I am. Okay. So I did want to follow up on what Veronica said, and Fred kind of brought it right back to that, which is we want to see the health and safety committees be proactive, not reactive. And I think that was, Fred really gave an example of how reactive they are rather than looking ahead and what can we talk about. So we've been working with Veronica on a health and safety guide to, you know, like she said, to kind of teach people how to not only bring up the topics, but what topics to bring up, the timing when that might happen to be the most effective, because, you know, budget cycles are one thing, time of the year, season, et cetera. So different things are maybe more urgent in different time periods. So that's something to think about. And so that's why that's a couple of the ways we'd like to see health and safety committees be more effective and efficient. And so that's really important to us as well.
And I thought of something while Fred was also speaking. In my past work, I worked more with, I worked with a lot of people, but I did a lot with safe patient handling. And that legislation for New York that requires hospital settings to think about assisted lifts. So they want to promote safe lifting practices to save the backs of nurses and physician assistants and techs. And I just think it's I like the way that they wrote that legislation, although there's no enforcement piece, is they speak very highly that a committee needs to exist in every facility to kind of consistently be assessing the needs of staff and how equipment that's introduced is working. But particularly there's one piece that talks about if there's going to be a major construction project, the committee needs to specifically get together to discuss that construction project, to see what safe patient handling equipment may be able to be introduced into the construction plan. For example, there are some rooms that can have kind of overhead lifts that are into the wall and built into beams that really require a huge construction project. But if it can be assessed quickly and it's written into the requirement as one of the things that that committee has to discuss, that's very useful. Because I will point out that if we didn't have the regulation from SED about these health and safety committees, what would need to be done would be for the unions to bargain for them. That's what a lot of unions do. They bargain for these labor management style health and safety committees, and also some language in their contract that the employer needs to provide them with a safe and healthy workplace. So it really is a great opportunity that we have. And I think everybody's experiences with what works best for people and having that committed group that has to get together. And I think pointing out to schools that it's required all the time, not just when you want to discuss how to realign a new space or because something awful has happened is important. And again, that's all based on education and then sharing best practices from learned experiences from folks like us here on this panel.
I have everybody who has their IDs up. Thank you. You're all set.
I wanted to add something and kind of following up to what Michelle was saying about being proactive versus reactive and in relation to IPM and in relation to the current situation, this pandemic, and the recommendations and guidelines that are being given to the schools. And it's just thinking ahead of time. We know the past, we know how to keep them away, you know, the pest exclusion concept and things like that are going to be a little bit hard to apply in the fall. We're just gonna embrace the uncertainty. So we're gonna have to leave windows open and doors open, and we're gonna allow all these critters to go back into school. So I think, you know, there's gonna be, I don't know if there's some guidelines, basic guidelines put in place by schools, just thinking ahead of what's going to happen if we leave windows open. How do we keep that ventilation and somehow prevent some pests to come into those buildings? Because now you're going to open a new door for some big issues in the school. So you get wasps, you get ants, you get maybe even ticks getting into buildings, and then there's going to be a liability for those schools. So it's just everything we're doing right now with this virus is fairly new. So and we're just learning and kind of readapting what we know to the current situation. So I think schools, they probably have to do that. Just have that maybe a short time guideline or steps just to ensure that you're going to minimize that risk, because you know some problems are expected to happen. So I really like that comment made by Michelle about being proactive, not being reactive, and again, it's just under these uncertain periods that we're dealing with.
Before we lose everybody, I just want to mention that today we really looked at the where we have been portion of school IPM and what resources are out there. Next week, we're going to have speakers that are going to focus on specific pest issues, specifically rodents, deer, and mosquitoes. And with deer, we're also tying in ticks with there. If we had done this in person, we would have had tables. So we're going to have a speed dating rush of people letting us know what kind of other resources are out there. And then we're going to break up into smaller groups. And one group is going to talk about community responses to bed bugs. One's going to talk about community responses to German cockroaches. And the third is going to talk about IPM priorities as we move into the future. So we hope that you will definitely join us next week. And they are separate certification credits. So for today, you'll get the credits, and then we'll do that whole process again next week.